those right now. Okay, I'd like to call the meeting to order of the Human Services Committee, but we are not at a quorum, so we'll start as a subcommittee. In terms of announcements, 3 bills have been taken off our calendar and made 2-year bills per the author's request, and that's first one is item 8. This is AB 671 by Mr. Portantino. The second one is item 16, AB 1140 by Mr. Donnelly. And the third one is item 21, AB 1312 by Mr. Smythe. Those bills will not be heard today. They are taken off our calendar. We do not have a quorum, so we cannot act on our consent calendar, but as an announcement, item 6 is proposed for consent calendar. That's AB 533. That takes a vote of the committee to approve that as a consent calendar item. In terms of hearing, we'll start with Ms. Yamada is always the first one because she always signs up first, and I haven't had a hearing where she wasn't the first one. She's very good at signing up first. She has 2 bills, and I believe Ms. Yamada will start with item 18. Is that correct? This is AB 1147.
Yes. Thank you, Mr. Chairman. I do actually have 3 bills before your committee today. One.
You will hear all 3 right now, and one of them, I said earlier, was on consent.
Oh, okay. I'm sorry.
But we
were
cannot
outside.
vote until we have a quorum.
Absolutely. All right, then let me begin, if I may, and thank you, Mr. Chair and members, with AB 1147, which is the Teen Parents in Foster Care Reporting Bill. What AB 1147 does is really very simple and straightforward. It builds upon the great work that was done in 2004 when we developed a foster care, the Teen Parents in Foster Care Act of that year, done by our good friend and colleague, former colleague, Sheila Kuehl. Right now, a child social worker when they are in foster care is required to file a report with the court every 6 months detailing progress and services that are provided in their case plans. AB 1147 simply adds one additional reporting requirement, and that would stipulate to containing information on the age and developmental appropriate services that were provided to a minor parent in foster care. Of course, one of the goals in foster care would certainly be to hopefully prevent teen pregnancies or pregnancies during foster care, but that's not always the case. So when there is a foster child or a foster youth that becomes pregnant and gives birth, I believe it is our obligation to strengthen the existing law in order to serve and protect that parent as well as the child and try to keep that family together. And I'm delighted today to be joined by 2 principal witnesses in support of AB 1147. First, Sonia Fernandez, who is with the Women Lawyers of Sacramento, and then Larry Doyle, who's the legislative representative of the Conference of California Bar Associations. And I'll turn to them now for additional testimony, if I may. Thank you, Mr.
Witnesses in support.
Yes, my name is Sonia Fernandez. Thank you, Chair and committee members. I offer testimony on behalf of Women Lawyers of Sacramento and also as a former child advocate. Lisa entered foster care at the age of 14 as a result of over 200 incidents of sexual abuse by her mother's boyfriend and her mother's failure to protect. At 17, Lisa was pregnant and was to give birth soon after her 18th birthday. However, she was scared because at 18, Lisa would emancipate from the foster care system with no skills, no job, and no housing. Lisa's plan was to move in with her mother and her mother's boyfriend. Lisa did not realize that by doing so, she would not only be exposing herself to additional abuse, she would now be exposing her child. Lisa, due to her own failure to protect, would risk losing her baby. Fortunately, Lisa's attorney, prior to her emancipation, informed the court of Lisa's plan. The judge ordered the county to locate a transitional housing program where Lisa and her child could be safe. In courtrooms throughout this state, minor parents who themselves were victims of abuse and neglect are at risk of losing their children. Our foster care system is overburdened, and as a result, many children fall through the cracks. Lisa was almost one of them. The state, acting as a parent, can do a better job of ensuring that minor parents in foster care are given every opportunity to succeed. AB 1147 will allow the state to measure and evaluate its success in meeting the goals of the Teen Parents in Foster Care Act. This bill includes a simple mechanism that will help reduce the number of minor parents and children that fall through the cracks, help strengthen families, and increase the success of minor parents in foster care by voting aye. Thank you.
Okay, I wanted to, before you go on, announce that we have a quorum, and I'd like to have roll call taken so we can actually vote on these bills. That would be nice. So, please call the roll.
Bell.
Here.
Jones. Here. Amiano. Grove. Hall. Portantino.
Here.
Now a quorum. And in terms of action, we have an item on consent, and that's Ms. Yamada's AB 533. Is there any objection to that item being on consent? Okay, then we'll leave it on the calendar. Okay, and so Ms. Yamada, you may continue.
Thank you. I'd like to turn now to Mr. Doyle, who's, as I mentioned, the legislative representative of the Conference of California Bar Associations.
Good afternoon, Mr. Chair and members. AB 1147 is a very simple bill dedicated to the prospect, to the idea that we want to make as efficient use of resources as possible. In 2004, the legislature enacted the Teen Parents in Foster Care Act, which established legislative intent regards how we should deal with and how we should encourage and support teen parents who are in foster care. The Act provided that certain services be provided to these teen parents in foster care, but the Act did not include a reporting mechanism to determine just exactly how well it was working. However, under current law, social workers are required to make periodic reports to make about how the foster care system is working for the everybody, including these teen parents. AB 1147 is based on the prospect that the two should be brought together, and that the reports that are already mandated under law simply be expanded to include an element that says, with regard to teen parents, you should report on those things that the Teen Parents in Foster Care Act says that you should be providing by way of services. There are no additional expenditures required. There's no additional cost. It just simply makes specific in the law that since you're going to be making these reports anyway, report on the things that we've already asked that demanded to be done. It should be simple, straightforward, and efficient, good use of taxpayer dollars, and we strongly urge an aye vote by the committee. Thank you.
Okay. Thank you. We have witnesses in support, please. Any witnesses in support come forward?
Good afternoon, Mr. Chairman and members of the committee. My name is Michael Levy. I'm president of the Sacramento County Bar Association. We urge an aye vote on 1147. Thank you.
Thank you.
Rebecca Gonzalez, National Association of Social Workers, California chapter. We are also in support.
I think if Mr. Portantino would let you, you can use that mic by him.
That's easy.
I think that's more comfortable for everybody. Thank you.
Thank you, Mr.
Yeah, that's fine.
Hi, Leslie Heimov, Children's Law Center of Los Angeles. We were the sponsors and primary drafters of the prior legislation that was referred to and are in support of today's bill.
Okay.
Thank you.
Elena Perez with the California National Organization for Women in support of the bill.
Okay. if there's no other supporters, we'll ask for people that want to speak in opposition to this bill. Come forward, please. And I see none. Is there a motion on this bill? Move the bill. Okay, second. And questions from members, please.
Just a couple of
Mr.
quick
Jones.
questions. I noticed
Yes.
that you quote some statistics in your presentation. Do you know how many foster teens this bill will affect? Do you have a number, or I'm looking for a number if you've got a number, but a percentage of a number would work as well if you've got.
That is a good
That's just-
question. We do not have current statistics maybe for this past year, but we can certainly try to provide you additional information going forward. I do not have that
Okay.
statistic in front of me today.
Probably a more important question for me is, in the foster care program, are there pregnancy prevention principles or education or to kind of prevent this from happening?
Yes, I know. I think I alluded to that in my opening, and that is that the goal certainly would be to try to prevent
Sure.
the pregnancy, any teen pregnancy, and particularly in foster care. I think that foster children, are certainly exposed through not only their schooling, but through other wraparound services that are available to them, to an array of services. But that does not always prevent the pregnancy.
No, I understand.
No, I think
So they have access, or they should have access. But as you know, the last several years in our state in particular, we have seen a decline
Right.
in a variety of these support services. So I think that's why it's even more incumbent upon us to strengthen existing law as is presented in this bill. And you might ask, isn't this being done anyway? If this is something that should be required to be reported by social workers, as you know, I'm the only social worker in the assembly, and so I would certainly hope that all good social workers would do this report on their own. At the same time, I will tell you that because social workers do not have title protection in this state, there are people who are hired in positions and referred to as social workers that do not have the professional training in these arenas. And I'm not saying the people that are in those jobs aren't good people, but there are a lot of dynamics at play in this effort, and so we're just simply trying to codify now into state law this requirement that should come at pretty much no cost.
Okay, thank you.
Thank you,
I think,
Mr. Jones, and we'll get that data for you.
Well, we got some. The University of Chicago did a study on Illinois, not California. We asked the State Department of Social Services to that particular question, actually, when the bill was being reviewed by our staff.
Okay.
But the University of Chicago did a study of state of Illinois, and they found that 71% had a pregnancy by the time they were 21. So it's a high prevalence.
Right.
Well, the percentages are in the analysis.
Yeah,
I
and
know
that's what
they are
kind of spurred the.
stipulated not
But we
to,
don't know
to
what
California.
California
Right.
numbers are. So
a
perhaps
good-
if we
good
could now,
question.
because the committee's interested, we can ask the department to try to find out what the numbers are for everybody, so we can get that information, because I think that's a very important statistic. 'Cause
It is.
I asked that, now the vice chair asked it.
Well,
We are
Good
we are
question.
talking about reporting in this circumstance, to the extent that the social workers are now asked to know what kind of services are being provided. They will also be, by implication, providing information as to how many people are being served under this particular program, which
Right.
will provide a more substantive answer to your question than just simply our estimates at this point in time.
And for the purpose of this discussion, I'd be interested in the teen numbers, not the by 21 or by 25. And then also just some feedback or some information on, what are the teen pregnancy prevention education models or whatever that they're using to accomplish the goal of reducing the teen pregnancy. I'd
Very
appreciate
good.
that.
Good
Thank you.
questions all. Thank you very much.
Okay, We have any other questions from members? Author's closing statement?
Well, I respectfully ask for your aye vote and thank you all for your interest in this topic. I know the chair has had a long interest in foster youth, and I ask for your aye vote.
Thank you very much. If there's no other question, we have a motion for due pass, and we can call the roll. This is a due pass. Mr. Hall just walked in, so it's a due pass motion on Ms. Yamada's bill, and that's 1147. We have a motion and a second, so call the roll, please.
Bell?
Aye.
Bell, aye. Jones? Aye. Jones, aye. Amiano? Grove? Aye. Grove, aye. Hall? Hall, aye. Portantino? Aye. Portantino, aye. Bill is out.
Thank you very much.
Okay, you have a second bill and a third bill, so.
I do indeed, and let me just ask the pleasure of the chair. I understand that Ms. Grove had a question or wanted to pull 533. Would you like to do that one?
Why don't we take that one now, then?
That would be fine.
That's item 6, and that's AB 533. So,
yes. Well, let me quickly present the bill. AB 533 seeks to
move the bill.
Thank you. To provide for a continuous appropriation of the federal portion of aging and rehabilitation funds. In the annual budget stalemate, as we all have experienced, either inside or outside this building, we know that many organizations find themselves in very precarious situations, both trying to deliver services as well as stay afloat, sometimes at much higher cost and interest because they have to take out loans. I know that we probably have all been contacted by constituents who have sometimes had to mortgage their own homes in order to keep their agencies afloat. So we believe this is a pretty straightforward requirement. It is a federal portion only, and would certainly ask for your aye vote.
Okay, Member Grove had a question, so why don't we ask the
I
question?
do, and I'm not sure if my question needs to go to Ms. Yamada or the chair. My concern is that there's no appropriation. It's just a pass-through of federal funds. And when the state doesn't keep its fiscal house in order and we cut off funding until things are squared away up here, why is it necessary to cut off federal funding as well? And if there is no necessary reason, and it's just this bill is just ensuring the pass-through, why is it necessary for this bill to go to appropriations?
Well, I think that's an excellent question, and I think that aside from the fact that, you know, as the chair of Aging and Long-Term Care, I'm here advocating primarily for those federal funds that pass through to aging and rehabilitation. The argument could probably be made for a variety of federal funds that the state really has, no claim to other than to be the pass-through agency. So I would be delighted to engage in that conversation. However, these bills are, referred by the Assembly Rules Committee. And this isn't, by the way, for those of you who are freshmen this year, this is not a new bill. This has been tried a number of times in the past. I remember being on the Yolo County Board of Supervisors and having to really struggle every year, seeing especially our seniors and people with disabilities, struggle because of the annual budget stalemate here. So I don't know. I would look to the chair for guidance on this. I don't know that this body cannot make that determination.
Probably. It'd be good. Generally, the policy committee recognizes the need for smooth flowing operations in the use of the federal funds. If you have a budget process whereby how would you say it, fits and starts. Sometimes
it's a little
we
bit
have
like learning
2
how
or
to
3
drive
budgets
a stick
in
shift.
1 year. We don't approve the budget on time. If you have that kind of process, what happens is these agencies can't really efficiently expend the funds. So it's always been the suggestion in terms of operational efficiency from the policy committees of the legislature that we have a continuous appropriation of the federal funds, which does not involve state general fund money. When that policy recommendation goes from the policy committee, which is us, to the appropriators or the budget committee, it is always turned down.
For what reason?
They believe that the
Just a
budget should be approved as a whole, and the budget's, that's their thought.
So is
but
it, with all due
there's a
respect,
dispute between the policy committee generally and the appropriators on this subject, I would say.
so with all due respect, is it fair to say that this money is held up for our aging and adult services, aging and disabled people, because of it's held hostage because of a budget issue?
Well-
It actually is just pass-through money that they should be receiving anyways?
You could say that.
Yes, I will say that. because
Pretty
quite-
much. I mean,
Yes, I will say that.
we don't approve the budget in pieces. We approve the budget as a whole.
But this
And-
money has
and-
nothing to do with our budget. It's just pass-through costs from the federal government,
Well, it
correct?
is a part of our budget because our budget includes all federal, state, special funds, general funds. So it is part of our budget approval to have this money. So they have some speakers in favor of this, correct?
Yes, we do.
Yeah, we have some speakers that want to explain it from the standpoint, from their view. So please come forward.
And back to that, I apologize, but is there a way to make a motion to go straight to the floor, or is that not possible?
That would be the decision of the Rules Committee.
Yes.
Can we
Not
refer
our
back to
policy
rules?
committee. The Rules Committee will make the decision.
Can we make a motion to refer it back to rules to make that committee decision?
We could do that.
Great. Thank you. Sorry, Mr.
We,
Chair.
not at all.
I will be making a subsequent motion to pass this committee based and go to appropriations as was already declared the next body to hear per the chair of the Rules Committee. Just FYI.
Oh, okay.
Okay. Go ahead, please.
Yes, Mr. Chair, members. Daryl Kelch with the California.
Excuse me. I think Mr. Portantino on the issue, please. Sorry, I apologize.
It's okay.
Yeah, I was going to say, I think it's appropriate that it follow the referrals that are on the board, but there's nothing to say that members of the Appropriations Committee can't then make a motion to refer it back to rules or to the floor or to pass it. I mean,
Yeah.
that's what the next committee, on majority vote of that committee, would then.
Our committee
decide.
generally doesn't have a jurisdiction over budget appropriations.
But certainly,
That's-
any member
that's
of the
certainly-
Appropriations Committee can make a motion,
Right.
and it either passes or fails.
We don't have jurisdiction under the rules of the legislature over appropriations, but, okay, go ahead, please. Thank you.
Yes, Daryl Kelch with the California Association of Area Agencies on Aging. Your remarks are right on point. Over the years, the difficulty with passing a budget has always become the problem of area agencies and how to continue to deliver services to seniors. And unfortunately, what happens is as this time grows near, seniors start getting very worried, anxious. Are they going to continue to get services? We have seen cases where services have been stopped because the area agency just did not have the money to continue to provide those services. Area agencies go out, they get lines of credit. Those that are connected with counties, the counties have been the deep pockets. But as you all know, counties can no longer do that. So the seniors are put in jeopardy simply because of not being able to pass a budget up here. The unfortunate thing is that area agencies by federal law cannot recoup the cost, the interest of borrowing money. That's prohibited. So they have to figure out how to absorb that cost, but often that comes out of the services of the older person. There are other examples where federal dollars are passed through. I mean, there are Medi-Cal services that are paid because of federal litigation. And we looked at that option, we being the area agencies, but there was not any legal standing in which we could go to court, and we would have to have federal standing in which to take this to court. And so we have time after time, I think your analysis correctly shows that over the years, we've come to the legislature 4 or 5 times seeking a remedy. And it just gets bogged down into politics. Part of the reason is because some legislators over the years have said we want the seniors in the street talking and crying that we should have a budget. We want them with the other masses out there. Well, I'm here to tell you it hasn't worked over the years. What happens, as I said before, is that services start getting cut. Area agencies start doing everything they can to keep services going, and we need to solve this problem. And we would encourage your yes vote. Thank you.
Thank you.
Teresa Renkin, Alzheimer's Association, in support.
Thank you.
Will Tift, Area 4 Agency on Aging, strongly in support. I'm also authorized to give the support of our Independent Advisory Council, Area 4 Agency on Aging. Thanks.
Rebecca Gonzalez, National Association of Social Workers, California Chapter, in support.
Thank you, Mr. Chairman and members. Casey Kaneko of Suter and Associates on behalf of the City and County of San Francisco in support. Thank you.
Carol Risley, representing the State Council on Developmental Disabilities. We're in support of this. We'd also urge you to look at the other systems that are facing the exact same issue and have the federal monies coming in. Regional centers are spending huge amounts of dollars every year on interest for which they cannot recoup, and it's going out of the pockets of the people that you want it to go to.
Karen Jones with the California Long-Term Care Ombudsman Association, and we're very much in support of this. Our programs regularly have trouble providing consistent services in an area that really, really needs consistent services for the folks who live in long-term care facilities. Thank you.
Okay, thank you. Witness, we don't have any other witnesses in favor. If not, I'll call for anybody opposed to the bill. And I don't see any appropriators here, so. Yeah, just some of them maybe. Okay, so I call for a motion on this bill from members. We have a motion and a second to do pass the bill. And we have any additional questions? Anybody? Author's closing.
I respectfully ask for your aye vote. We can certainly continue the conversation about the best way to pursue it.
Okay.
But I thank you all for your interest.
Okay, the motion is to pass the bill, and we'll call the roll.
Bell.
Aye.
Bell, aye. Jones. Aye. Jones, aye. Amiano. Grove. Grove, aye. Hall. Hall, aye. Portantino. Aye. Portantino, aye. The bill is passed.
Okay. And one more.
All right. Thank you very much. Don't want to monopolize my time here, but I am delighted now to present AB 899, which we
Item
are calling
12.
Home Care for All. Okay. Mr. Chairman and members, we all know that aging is not a partisan issue because the last time I checked, not a single one of us was getting any younger. And except for me. You and what was that movie? Benjamin Button or something like that. Anyway,
Back to the Future.
None of us have time to go to the movies. I am proud to be the author of this bill that seeks to really start to give a framework and a structure to home care in our state. I think many of us labor under the false impression that when we get to a point that we will need some assistance with activities of daily living in our homes, that we'll be able to rely upon, what is currently in effect. There are sometimes series of agencies and other resources out there to find someone to come in and frankly perform some of the most intimate tasks that any of us would ever face. We know that in the IHSS program, which is, of course, an entitlement program based on income, there are certain safeguards that have come into play over time with legislative action. And then, of course, if you're fortunate enough to be extremely wealthy and you have someone managing those activities for you, perhaps you don't have as much to worry about. But the great middle, which I believe most of us fall into, at least we're trying to hang on to that station in life, would be faced with several decisions about who and where we would call, and the guarantee that the individual that would be coming into care for you or your loved one was properly screened and vetted and had all of the training to, thank you, to
Motion second.
to ensure safety. And yet we do not have that yet in California. AB 899 seeks to take that first step. And with me today, I have first Peter Kellison to be able to testify, and then my good colleague from the Alzheimer's Association.
Now, before you discuss, I want on the motion, that includes the amendments. Is the author accepting those? Yes. Okay, and the second includes the motions. Okay, proceed, please.
Peter Kellison on behalf of the California Association of Health Services at Home. This is the second time this organization has sought to regulate the private home care industry. The first was 3 years ago in legislation carried by Assemblymember Dave Jones. In the interim, the past 3 years, our organization has actually attempted to self-regulate, because currently, as the Assemblymember mentioned, there is no regulatory structure currently for private home care agencies. That effort resulted in about 150 to 200 of the 1,200 estimated home care agencies participating in the self-certification, but there was no enforcement mechanism. And ultimately, that attempt at self-regulation does not meet the demands that the industry and the consumers perceive and expect of providing insured safeguards for consumers in a cost-effective manner. So we are pleased to sponsor this legislation. We believe that roughly 2/3 of the states have a regulatory framework for the private home care agency. We think that California is due. We think that the licensing structure that we have provides that careful balance that needs to be struck between consumer protection and cost effectiveness, and doing so by vesting the regulatory authority within the Department of Social Services is appropriate. We're happy to work with those who also are engaged in this issue. Look forward to robust discussions, and am pleased to answer any questions from the committee should there be any.
Okay. Other speakers?
Hi, I'm Teresa Rentgen with the Alzheimer's Association. This year, the first baby boomers turned 65, when the risk of developing Alzheimer's disease significantly increases. With this first wave, there is an impending wave of new cases and new families that will have to face this devastating, deteriorating, debilitating, and heartbreaking disease known as Alzheimer's, a progressive and fatal brain disorder that causes problems with memory, thinking, and behavior. Family members take on a great deal of the caregiving. Home care aides provide critical assistance on a wide array of daily tasks, including bathing, dressing, feeding, housekeeping, and more. Such services allow family members to continue to work and assist in individuals' wishes to remain in their own home. More than 1/3 of older people who receive primarily non-medical home care services have cognitive impairment consistent with dementia. Currently, businesses face as much as $1.4 billion in lost productivity each year as family caregivers miss work, reduce their hours, or change jobs. Alzheimer's doesn't just affect those with the disease. It also takes a toll on the family, financially, physically, and emotionally. Just imagine the tragedy of watching your loved one, the light of your life, slowly disappearing day by day. The families of people with Alzheimer's are already dealing with a great deal, and they are looking towards home care aides to assist in the daily needs of their loved ones. They need to be assured that the person that they have chosen is trained, qualified, and licensed. Individuals with Alzheimer's are physically frail, and as the disease progresses, their ability to comprehend and complete simple tasks deteriorates. Given that individuals with Alzheimer's may be unable to communicate abuses to their family members, they are therefore at greater risk to experience abuse than an individual who is cognitively healthy. We support AB 899 because we believe that by implementing training, background checks, inspections, and licensing, it will greatly protect our most cherished population, our elderly.
Okay.
Thank you.
Other witnesses in support, please. And we just want to indicate your support and the name of the organization you represent, please.
Buck Shaw, owner of Home Instead Senior Care, providing care to seniors in this community for about 14 years, strongly in support of this bill.
Thank you.
Pat Blaisdell from the California Hospital Association. With the author's acceptance of some clarifying language and amendments, we support this bill.
Thank you.
Christy Ronner with Maxim Healthcare. We have agencies throughout the state of California, and we're in support.
Thank you.
Candy Smith, 8-year owner of Homestead Senior Care, and strongly support.
Okay. Other individual support? Seeing none, we'll now hear from the witnesses opposing the bill.
Oh, okay, that's all right.
Sort of.
That's all right.
Robert Harris on behalf of Service Employees International Union, California. We aren't opposing the bill, but we're unable at this point in time and space to support the bill. We think that we're working on parallel legislation over in the Senate. That we think that there's some weaknesses in terms of consumer protections in this specific bill. One of the primary ones is we worked for years to make sure that I think 6 years, 8 bills to finally get background checks for IHSS consumers, providers. And as we went through the process, originally some of the counties were using the background check system proposed by this bill that we at first actually grandfathered those in and then said everyone else would use DOJ live scan. We discovered the flaws in that and the fact that made it actually untenable to actually get good reports on all the crimes that are really important for people. And so we ended up going with live scan DOJ background checks. That's what we have in our bill. We think that's a important consumer protection for this bill. The second thing is there was just a report out by the Office of Senate Office of Oversight and Accountability. Yes, thank you.
Yeah.
And that
I just got that too. I haven't read it yet though.
That part of what that they talk about is part of the problem is people moving between agencies, and that the only way we think you can actually control that and have data and keep people safe in their homes, despite the best intentions of any agency, is if you have some kind of certification system for the people who provide the services, that once you have that kind of certification, you can have bad actors not able to move between agencies. Everyone knows who they are. That protects consumers. This is a huge issue for all the START programs in the counties, the fraud programs for elderly. That's part of what they've been trying to deal with. Some counties have actually started moving on their own to deal with it. But if you want to make it really work across the state, you've got to do something about the people who provide the services, not just the companies. The third thing that we think that provides better regulation is a different regulatory body. And it's for two reasons. One, as you heard the person from the Alzheimer's Association describe it, that the people in that association and most of the other people who need this service need it because of deteriorating health conditions. And that means that even though this isn't technically a health program, that it does do things. We know at IHSS, which is why why the federal government pays half the cost of IHSS, is by providing these services, you keep people in lower cost settings that lower healthcare costs. The same thing happens with people who are private pay and also get Medicare, which many of the people who get this services do. We think that the regulatory body, therefore, should be a health-oriented body.
Mr. Chair, move the bill.
There's a motion, second, to approve the bill.
And we look forward to working with the author to continue to fix the bill.
Absolutely.
Now, my understanding is the bill going to Judiciary Committee, and a lot of those background check issues usually come up at the Judiciary Committee level, and the author, I understand, is willing to work with
we are
people
certainly willing
about
to
those.
continue our conversations.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
And we have a motion to approve the bill as amended with that amendment clarifying some of the definitions.
Yes, I believe that was just stipulating to some concerns from hospital and what was the other? Yes, assisted RCFEs.
Community Law Center, yeah.
Right.
Is there other questions from committee members? Any questions? We have none. Author's closing.
Respectfully ask for your aye vote.
Okay, thank you. And we'll call the roll, please.
Bell.
Aye.
Bell, aye. Jones. Jones, no. Amiano. Grove. Grove, no. Hall? Hall, aye. Portantino? Portantino, aye.
Thank you,
Bill's
Ms.
on call.
Yamada. You're on call with
Thank
that
you
bill.
very, very much. Thank you, committee
Okay, thank you very much. And I believe Mr. Dickinson's next. He is here. And he has item 10, AB 823. I'd like to announce that Mr. Logue has informed the committee that item 13, AB 924, is being pulled. So Mr. Logue is pulling that item. We will not hear that item today. And I'll turn the floor to Mr. Dickinson. This is item number 10.
Mr. Chairman and members, good afternoon. I'm here on AB 823, which would establish a children's cabinet to foster greater coordination, collaboration, and efficiency in the provision of state services for children and youth and their families. And I have to say, well, I'm invested in all the legislation I'm carrying. This one is, to me, truly special. And it builds on experience I had as a Sacramento County supervisor when we established a family policy board, which was devoted to the issues related to families and children, and found that it was very useful, meaningful, and effective in helping us as a county to look at the issues across the spectrum which had an impact on the lives of children and families, permitting us to create coordinated, cohesive policy and fiscal approaches to their well-being and welfare. In this case, at least 18 states have established children's cabinets, which are made up of decision makers. And I think it's important to underscore that, and they come from those government agencies who then meet on a regular basis with a collective goal of coordinating services, developing a common set of outcomes, and implementing plans to foster the well-being of young people. Now, the budget circumstances that we face and our discussion about realignment efforts, I think, accentuate the need for this kind of coordinated policy approach across state agencies and interested entities. We need to maximize our federal funding. We need to minimize our duplication and overlap in policies and services. We need to establish clear priorities and outcome measures for the benefit of children and young people. According to the National Governors Association Center for Best Practices, a strong and effective children's cabinet can improve coordination and efficiency across state departments and local levels of government, can mobilize resources around priorities for children, thereby facilitating a holistic approach to serving children, and strengthen partnerships with the nonprofit and
There's a motion and second to approve that bill.
private sectors.
Or pass the bill.
There are authors' amendments, which I have agreed to take, and I appreciate working with your staff to develop those amendments. There's no known opposition to the bill, and I would respectfully request an aye vote. With me is Nasette Short and Brad Strong from Children Now, who are the sponsor of the bill.
Okay.
So I will just speak on behalf of Children Now. So Brad Strong, Children Now. Children's cabinets throughout the nation are working, and they're getting great results. I think the Assembly member has done an exceptional job in laying it out. Really, in California, we do not have a coordinated vision for providing services for children and youth. We really don't have an clearly established and monitored goals for children, and we really don't have a statewide plan for improving the coordination and delivery of services for children and youth. AB 823 will establish that venue where the superintendent, agency secretaries, and the directors convene to more effectively serve children. And the cabinet is comprised of the highest level folks, the ones that truly have the authority to set and implement policy in coordination with the governor, and we ask for your support.
Thank you. Other witnesses?
Thank you, Dawn Kepke with McEwen Associates on behalf of the Child Abuse Prevention Center, also in strong support. We really have concerns with the resources that are certainly fewer and fewer with each passing year, and so we really think this bill is critical and will be extremely helpful in coordinating and providing efficiencies, as well as just elevating the important issues facing children in California. So for this reason, we support it. Thanks.
Thank you.
Mr. Chairman, members, Randy Perry there, and Reed and Associates on behalf of the California Children's Hospital Association supported the bill. Any commission that can maximize the federal dollars back to California and maximize efficiencies we need, and so we support the bill.
Thank you. Other witnesses support? There's a convenient microphone over there. Yeah.
Alice Ricks, California School Health Centers Association, and strong support.
Thank you.
Kim Lewis representing Aspiranet and the California Coalition for Youth and support.
Beth Thompson, Fight Crime Invest in Kids, representing over 400 sheriffs, police chiefs, and DAs in strong support.
Okay.
Erica Root on behalf of the California Family Resource Association in support.
Okay. I'll call for any opposition to this bill. Anybody want to speak opposing this bill? Seeing none, we have any questions on this from people in the committee? None. Authors closing.
I would respectfully request an aye vote. Thank you.
And we have a motion to do pass the bill as amended. And if there's no questions, we'll call the roll, please.
Bell?
Aye.
Bell, aye. Jones?
No.
Jones, no. Amiano? Grove? No. Grove, no. Hall?
Hall, aye.
Hall, aye. Portantino? Aye. Portantino, aye. On call.
That bill is on call, and thank you. And I'll turn it over to the Vice Chair. I have to present a bill in the Health Committee, so I'll be right back.
Okay, so
Yeah, go ahead. Portantino has a bill.
Mr. Chesbro, you can go ahead and go. Ms. Bonilla is stuck in committee. So next we'll hear AB 1142 from Mr. Chesbro, item number 17.
As long as they need to convince you. Open.
Move the bill.
We have a motion and a second. Mr. Chesbro, would you like to defer to speakers in support?
I'd be happy to do that
Okay.
if that's the wishes of the committee.
Thank you.
Hi, good afternoon. Heather Harrison with the California Assisted Living Association. We represent assisted living providers throughout the state. This bill ends a troubling and unnecessary practice. It will greatly benefit assisted living residents. The system outlined in the bill is currently in place in many assisted living communities right now, and it's proving to be a clear and fair process for all parties involved. So we strongly urge your aye vote.
Thank you. Next speaker.
Good afternoon, Chair and members. Teresa Cook on behalf of Atria Senior Living, a proud member of the California Assisted Living Association, also in strong support of the measure, and would like to thank the author for his work on this.
Thank you. Other speakers in support. Name and affiliation, please.
Teresa Rentgen, Alzheimer's Association in support.
Thank you. Are there any other speakers in support? Any speakers in opposition? Seeing none, we have a motion and a second. Please call the roll.
Bell? Jones?
Aye.
Jones, aye. Amiano? Grove? Aye. Grove, aye. Hall?
Hall, aye.
Hall, aye. Portantino? Aye. Portantino, aye. The bill is out.
Thank you.
Mr. Chairman, I just commend the assisted living facilities themselves for coming forward and asking that this be done. I think it's a good example of industry taking responsibility for trying to eliminate unfortunate practices. So I commend them.
Thank you. Next item is number 20, Mr. Chesbro, AB 1244.
Mr. Chairman, AB 1244 would do two important things. The bill's main goal is to give people with developmental disabilities the supports and flexibility they need to pursue their aspirations to make their own life decisions, such as where and with whom one lives, the role within his or her community, entering into or sustaining long-term relationships, and pursuing economic and spiritual goals. Basically, all the things that we all want in our lives. Right. Anybody wants, whether they have a disability or not.
Secondly, the bill will provide short and long-term cost savings to the state while providing regional center clients flexibility within a services budget as an alternative to the traditional developmental services system and statewide purchase of service standards. Briefly, if I may, I'd like to explain the bill's similarities and differences between current law and this bill. Key aspects of the bill are consistent with existing statute for self-direction, such as the program would be 100% voluntary. This option is only for people who are able and willing to control their own services budget. It uses a fiscal intermediary for paying the bills. People with use will use a service broker for intensive person-centered planning and putting together innovative supports to meet their IPP goals. Requires the average allocation to be 10% less than the historical cost to the state. So it is a cost-saving measure. AB 1244 makes important improvements over self-direction, such as focuses the program on universal human aspirations, requires the state to take responsibility for the availability of a competent direct support workforce for people hiring their own workers. The state would establish a base compensation level and would give workers hired directly by program participants the option to form a union if they choose. Gives program participants the right to hire the workers of their choice and supervise, schedule, and evaluate and dismiss them as they choose. Gives DDS flexibility in seeking a federal match, including the new Community First Choice option, which has a 56% federal match. Requires a statewide fiscal intermediary to ensure availability and low cost from economics of scale. Relaxes the prohibition on purchasing congregate services to allow attending congregate day services for specialized services, such as taking a class, let's say, every Thursday morning. Phases in implementation by starting in the 5 existing pilot regional centers to establish strong models for replication at other regional centers. Adds a self-determination advisory committee to ensure consumer voice in program design and implementation. With me today is Mark Pollitt with SEIU and Carol Risley. I got that. I'll get it right. I'm sorry. Only known you for like 20 years. With the State Council on Developmental Disabilities to support the bill.
Thank you. Speakers in support, please.
Okay, thank you. My name's Mark Pollitt from the Service Employees International Union. SEIU is pleased to support AB 1244 that would finally make self-determination available to all people in the regional center system. Over 29 states currently offer this option, and California has been piloting self-determination for 12 years. AB 1244 results from an informal work group that included participants from SEIU, the State Council on Developmental Disabilities, Disability Rights California, 2 of the self-determination pilot regional centers, and Mr. Tom Nerney of the Center for Self-Determination. We developed concepts for an individual budget option in California, and Assemblymember Chesbro has offered language to implement those ideas. SEIU's participation in this project results from our work over the last 2 years with the national leaders of the self-determination movement, including Mr. Tom Nerney, on addressing the interests of both people with disabilities and the workers who support them. As a result of this process, SEIU and the advocates came to a common understanding that the success of a person in self-determination rests on the availability of competent direct support workers. For this reason, Mr. Nerney worked with our work group to craft concepts that allow direct hires of self-determination participants to form a union and represent their interests to the state. I want to clarify that a union, should workers choose a union under self-determination, they would only bargain for a base compensation package from the state and allow participants to create incentive and compensation packages at or above that minimum. Also, under self-determination, a union would not interfere with a participant's ability to hire, supervise, train, schedule, or dismiss their workers. And as a general principle, increases in the base compensation should be paid for with increases to the participant's budget. SEIU supports this legislation because it is designed to help people with developmental disabilities emerge from historic discrimination. We understand that people with disabilities want to achieve basic human rights, such as making their own life decisions, deciding where and with whom one lives, having control or choice over who supports them, being able to truly participate in their communities in the ways that they choose, to sustain and enter into long-term reciprocal relationships, and to generate income to alleviate the effects of poverty. AB 1244 is designed to give people these options. It gives people with developmental disabilities the support they need to achieve this, and it aims to provide cost savings to the state. SEIU is proud to support AB 1244.
Gerald, feel free to call me Cheesebro if you'd like.
No, but I do
I
remember.
mangled your name.
Don't I remember some child calling you daddy in a hearing? No. Now, that was a really long time ago. Sorry. Couldn't pass up the chance.
Score is even.
It's done. Mr. Chairman and members, I am Carol Risley. I'm the Executive Director of the State Council on Developmental Disabilities. I had the privilege of working on the original language in 1998, and I'm sorry that we are now 12 years later and still trying to make the type of progress that the families and that the people with disabilities have been asking us to make for a long time. What we found out in these pilots is, in fact, that families are more careful with the public dollars than sometimes the public is. They understand that every dollar that they get must go towards certain outcomes, and those outcomes are articulated in the law: productivity, inclusion, and more independence. We have national studies that tell us that when people make more of their own decisions earlier in life, that in fact they are more productive adults. They tend to go more towards employment, and the ultimate outcome is less cost to the service system. We urge your support of this. We know there are people who say people with disabilities cannot make decisions. We also know that that's not true. We know there are people who say that you can't trust families. We've certainly seen that not to be true in our pilots. And we know that there are billions of dollars invested in private businesses that have a fear about what comes out of that. Again, if their business is good and it's providing for the outcomes that people want, people will buy those services the same as any other consumer does. So we urge your support of this. There is always room to deal with the details, but we have detailed ourselves for 12 years into doing nothing, and it's time to do something. Thank you.
Thank you. Other speakers in support, name and affiliation, please.
Go ahead, Greg.
Greg is here with the ARC and United Cerebral Palsy of California, advocates for people with developmental disabilities and their families. We strongly support the concept of self-determination, so we support this bill in concept. I think we're finally done with our analysis after working on it for some time, and there are few things we're going to be discussing with the author as the bill moves along. Thank you.
Other speakers in support?
Evelyn Abu Hassan with Disability Rights California. Disability Rights California is a statewide disability organization. We're a cross-disability organization. We have a support, if amended, on the bill. We did work with the various collaborators on developing this language with the author's office. We certainly support additional flexibility offered through self-determination and self-direction. We do have some concerns with reducing the percentage in the risk pool. The risk pool is currently set at 5%. This bill would reduce the risk pool to 2.5%. The risk pool is in place to address unanticipated needs of consumers that are in the program, and we think there are ways to work around our concerns, either by looking at the amount of projected savings that the state is going to have through this bill and reducing that savings in the first 2 years to restore the risk pool to 5%, or looking at the set-aside that's would be used for training and administrative functions and having that be reduced to restore the risk pool to 5%, or some combination thereof. The other concern that we have with the legislation in its current form is that while we support increases in worker wages and the benefits compensation package, we don't want that to inadvertently harm consumers. So any increases in the benefits package also need to be commensurate with, there needs to be a commensurate increase in the individual budget so that the consumers are still able to purchase the services and supports that they need, and that their budgets are not inadvertently reduced so that they are not able to get the services that they need.
Thank you. Has your office been in contact with the author?
We have been working closely with the author's office and others that are in support of this bill.
All right, thank you. Are there any speakers in opposition to the bill? Mr. Chesbro, would you like to address the amendment request? Or
Well, we're not prepared to take them today. I have a longstanding, very close working relationship with disability rights, and I'm quite confident that we can reach accommodation. I'd like to be able to offer them today, but they've they've been presented recently, and as I think Evelyn indicated, we'd like to sort of work on them to try to find the workable solution. They're both valid points that we need to address.
Okay, I just wanted to be fair and make sure you had an opportunity to address the concerns. Are there committee comments?
Thank you, Mr. Chair. Mr. Chesbro, I think this bill is a great idea. I really do, and I wish I could throw my support behind it. I know you don't need my support, but I cannot. I have to hold a stand to the fact that unions have way too much control over the legislature in this building, and to gain them more access through automatic deductions for more employees, if that was separated out, I would encourage other Republicans to come on board. But having that aspect in there, there is no way I can support this bill.
Did you second? Did Mr. Hall move before he left? That's what I thought. Okay. All right. Thanks for joining the meeting. We have a motion. We have a second. Please call the roll. I'm sorry. I forgot to let you let you close. Would you like to close,
Just
please?
2 sentences. After 12 years of piloting self-determination and demonstrating that it's not only an enhancement of the quality of life of the individuals involved, but also a savings to the taxpayer, it's time for us to make it available to all regional center clients who choose to and can participate. I urge your vote.
Thank you. Okay, now we can call the roll.
Bell? Jones?
No.
Jones, no. Amiano? Aye. Amiano, aye. Grove?
No.
Grove, no. Hall?
Hall, aye.
Hall, aye. Portantino?
Aye.
Portantino, aye. 3-2, it's on call.
You're on call with 3 aye votes. Is Mrs. Bonilla in the... Ms. Bonilla? No? Okay, I think
Carter.
Ms. Carter came in first, I believe. So, Ms. Carter, item number 7, AB 596. Huh? Let them do what? Oh. Ms. Carter, you have the floor whenever you're ready.
Thank you, Mr. Chair and members. Assembly Bill 596 would allow the same due process for CalWORK recipients of child care for stages 2 and 3 as afforded stage 1. It would require the State Department of Education to collaborate with welfare child care provider representatives and legal service advocates to develop and adopt regulations and procedural protections. Numerous legal services providers throughout the state have complained about the lack of due process afforded to stage 2 and 3 child care recipients. This bill would provide uniform and equitable due process throughout all 3 stages of CalWORKs. I have with me today to testify and support Mr. Kevin Aslanian, Executive Director, Coalition of California Welfare Rights Organization, who is the sponsor, and Jessica Bartholow, Legislative Advocate, Western Center on Law and Poverty, and I respectfully ask for your aye vote.
Thank you. Speakers in support, please.
Yeah, good afternoon. My name is Kevin Asner. I'm with the Coalition of California Welfare Rights Organizations, and I do a lot of pro bono work, and sometimes I represent people who have child care problems. And when I've been to these hearings, there were a lot of problems. There were no recordings, no cross-examinations. The purpose of this bill was to find a hearing process that would not be exactly the same as the welfare hearings are, but would also give people basic administrative procedures, such as being able to file for a fair hearing within 90 days, being able to have the hearing recorded, and some other elements that would not cost a lot of money. In fact, our intent in this bill is to meet with the child care providers and come up with a system that would provide some decent administrative hearings that would be cost neutral. And we're working on amendments to that effect, and those will be going in.
Thank you.
Thank you.
Hi, thank you. Jessica Bartholow with the Western Center on Law and Poverty. The subsidized child care program available through the state of California is to help CalWORKs recipients transition into a stable work situation. Without subsidized childcare, many low-income people who have left the CalWORKs program are not going to be successful in attaining economic self-sufficiency and staying out of a situation of needing to come back for CalWORKs. We recently, Western Center on Law and Poverty, recently represented a family, a single mother with 2 children, 11 years old and 6 years old. She's a single parent. Her adult parents are in the community, but they're very old and unable to take care of the kids. When she was determined ineligible incorrectly for her child care, she had to face the situation of perhaps leaving her children alone in an environment that was not safe for them, or leaving her job and returning back to CalWORKs. We need to have a system that makes sure that people who are in these precarious situations, who've left CalWORKs, who found jobs but still are not at high enough incomes to maintain them without child care support, are able to find due process when they're denied child care. So this bill is a great bill to help us get to that place, and will help a lot of families transition from CalWORKs successfully. We hope that you will vote aye for this bill. Thank you.
Thank you. Other speakers in support, if you can give your name and affiliation, please.
Dee Hamby with California National Organization for Women, and we strongly support this bill.
Thank you.
Nina Boothie with the California Child Development Administrators Association. Our organization has not yet taken a support position on this bill, but we are continuing to work with the author. We are a little bit concerned about the cost pressures for agencies related to this bill, but we are continuing the dialogue. Thank you.
Thank you. Other speakers in support? Are there speakers in opposition to the bill? Please come forward.
Mr. Chairman, members, Tim Fitzharris for the Child Development Policy Institute and the Professional Association of Childhood Education. 3 issues here. First, the public policy struggle that you've got basically is trying to give the rights and procedures that exist in the CalWORK system all the way across in the education system. If you do that, it doesn't exist in the education system, it's very expensive, and it's going to be at the cost of the availability of child care. So on the one hand, you're trying to provide rights, on the other hand, it's at the, as the advocates talk about, it might be, though, at the expense of people waiting for child care. So it's simple as that. Let me remind you of a couple of things that already exist in CalWORKs. If child care isn't provided, people get cashiered without having to work. So availability of child care is critical. Secondly, Stage 1 and Stage 2 are entitlements, more like the CalWORKs pieces of that. Stage 3 isn't. So the rules of Stage 3 may well be different, and you want to look at that and be careful about that. And general child care in the education system is also very different. More costs on the welfare to work side is going to take, because we've got history of this, is going to take money from the education child development side. It just happens that way. The entitlements are over here, fixed appropriations in the education side, and more costs over here takes it away from child development in the education system. Second issue, advocates say that the 2 systems should be the same, but they're really not. You have 2 different systems, Department of Education, Department of Social Services. 2 different departments, 2 different federal funding sources, 2 different rules on eligibility, and so on. Typically, the only ALJ-type hearings in education are special ed hearings on IEPs. We don't have that in child care. We don't have we have a contract system that basically is nonprofits and schools doing the child development and child care, both in Stage 2 and Stage 3. It would be very costly to those folks, particularly to the nonprofits. And third and the last issue is that they're very different delivery systems. In the welfare side, the county welfare departments make these decisions on eligibility and time and rule them out and whatever. And you fund, and the counties fund, the welfare departments to do those kinds of assessments, do those kinds of reviews, and then you fund the State Department of Education to do those hearings. You have administrative law judges there, a whole due process hearing, legal issues, and so on. Education has none of that. Basically, you're delivered by schools, who very tenuously do child care and child development right now, and nonprofits who have no legal counsel. They don't know how to do this at all, and you're creating a whole new system that basically would be very difficult for those folks. I think you risk schools doing child development here if we go to a full-blown legal adversary kind of system with all the due process, witnesses and evidence and reviews and recordings and all the things that go on. You risk the schools doing child development, and you also risk the nonprofits, many of my clients, that do this now. They would say, hey, just can't afford it. I can't send somebody to Sacramento every time we've got somebody we disallow here. So it's a very tenuous thing. I hear the author talking about, particularly for fiscal committee, talking about narrowing this bill. CDPI thinks that there are some tightenings that could go on here. But a whole full-blown due process system is very problematic for you, for the CalWORKs recipients, and certainly for the educational side.
Thank you, sir.
Thank you.
Thank you. Any other speakers in opposition? Okay. I'll entertain a motion if...
Yeah, can we respond?
I'm sorry?
Can we respond to this?
Respond.
Well, let me see if I get a motion first. And move the bill. All right. Okay, we have a motion and a second. Yes, Ms. Carter, you can respond and close at the same time if you'd like.
Thank you.
Yeah, basically, it is not our intent to have the same type of hearing for stage 1 that you have in stage 2 and stage 3. We've made that very clear to Mr. Fitzsimmons. I've also emailed him a letter to that effect. I've also emailed him proposed draft amendments that would make sure that there would be no cost pressure. And as the previous speaker has testified, that they're not opposing the bill because they're working with us, and we'd be glad to work with him and try to respond to all the concerns, because it is not our intent in any way, shape, or form to deprive people of child care in return for hearings.
Right, thank you.
Okay. And I agree that we are working with him, and I'm willing to accept amendments as we go forth.
Okay, great. Are there any other comments from the committee? Ms. Carter, would you like to close?
Yes, I respectfully ask for your aye vote.
Thank you very much. Please call the roll.
Bell? Jones?
No.
Jones, no. Amiano? Amiano, aye. Grove? Grove, no. Hall? Portantino? Portantino, aye. 2-2. The bill's on call.
Your bill's on call with 2 aye votes.
Thank you.
Thank you. She needs 2 more ayes. 4 to get out of here?
Yes, sir.
Okay, thank you. Ms. Bonilla? Mr. Garrick? File item number 3, AB 373. Mr. Garrick, you have the floor.
Thank you, Mr. Chairman, and members, those that are present. Thanks for the opportunity to present AB 373. This bill will limit the time an adult receives cash aid and employment services from CalWORKs. According to the Temporary Assistance for Needy Families, or TANF, website, TANF is designed to help needy families achieve self-sufficiency. States receive a block grant to design and operate their programs to accomplish the purposes of TANF. Those purposes are the following: assisting needy families so that children can be cared for in their own homes, reducing the dependency of needy parents by promoting job preparation, work and marriage, and preventing preventing out-of-wedlock pregnancies, and encouraging the formation and maintenance of 2-parent families. As noted in the committee analysis, which I'm sure everyone has read, CalWORKs is the name that is given in our state to the TANF program. The CalWORKs program offers those who are eligible some of the nation's most generous welfare programs and welfare benefits. Even with an 8% grant reduction implemented to be implemented on June 1st of 2011, California still ranks among the top 10 states out of 50 with the highest cash aid benefits. Not only does the state provide cash aid, the state also provides the following services: domestic violence services, substance abuse services, mental health services, help finding child care, cash money to pay for children while working or in welfare to work activities, cash money for transportation costs to and from employment, for welfare to work activities, and others, all under the TANF program, or CalWORKs. Even after an individual is off the cash assistance, they may be eligible to receive child care services for an additional 2 years and continuing Medi-Cal coverage. As you can see, California provides extensive and very generous support services for individuals to achieve self-sufficiency. According to the most recent data, only 25% of CalWORKs participants receive cash payments are meeting the federal government's own work requirements. Let me repeat that again. Only 25% of the CalWORKs participants that receive cash payments are even meeting the federal government's work requirements. Single parents are required to work or participate in work activities, which is an interesting phrase, and I'll get to later to describe, a minimum of 32 hours a week, or just 19% of the whole week. And in a two-parent family, one or both parents must work a combined total of 35 hours, or just 20.8% of the entire week, in order to receive the benefits. Activities that count towards the work participation rate that are not related to actually working and making money are adult basic education, job skills training, education directly related to employment, satisfactory participation in secondary school education, mental health services, substance abuse services, domestic abuse services. All of these are services that are provided and count towards those hours. According to the Department of Social Services, there are currently about 110,000 adults that have been on CalWORKs longer than 24 months. The savings associated with this proposal would be $163 million in cash grant savings and $324 million in service savings, the services I was just referring to, for a total savings of over $487 million. I support the goal of TANF, and especially that of CalWORKs, its general purpose, as we've outlined, to get people back up at work and being self-sufficient. But there are instances, and in these tough times, that people need to actually have some type of program like CalWORKs, but it doesn't need to go on as it presently does in our state for 60 months and or proposed by the governor to be 48 months to help you become self-sufficient. My goal with this bill is to highlight the multitude of services and aids that California citizens and taxpayers provide for those who are striving to become self-sufficient, and that those funds should be directed to those dedicated to achieving self-sufficiency. Thank you.
Thank you. I'll second the bill. Are there any speakers in support? Any speakers in opposition? Mr. Garrett, I just have a couple of questions. Oh, I'm sorry. I didn't recognize that you were coming towards the microphone. I apologize.
Hi, my name's Dana Spatson. I'm a former CalWORKs participant, and I don't believe there should be a time limit on assistance because there's no time limit on poverty. The unemployment rate for single moms has doubled since the recession began in 2007. It's at a 25-year high. The poverty rate is at its highest level in 15 years. And I had to overcome, I was homeless because of domestic violence. I had mental health issues like post-traumatic stress disorder and depression. You know, it took me a good 8 years to get over all that, get on my feet. I was making $4.75 an hour cleaning houses when I got on welfare. And I was able to go to school, and I now pay triple in taxes what I used to make in a low-wage dead-end job. So for me, on behalf of every single mom who's struggling to provide for their kids and build a future for their families, respectfully, I oppose shortening the time limit. I even think the 48-month time limit is a bad idea because it took me longer than 4 years to get on my feet and get my life together, and now I can support my family myself. But just in point of information, the recession is now entering its 4th year. So I think that our legislature should focus on time limiting that instead of time limiting poor children and their families.
Thank you. If I can just halt the testimony for one more minute. If there's one more speaker that would like to have a 2-minute time frame, I'll take that speaker first, and then I'll take speakers, just testimony in opposition. Thank you. We've had one speaker for 2 minutes. We'll take a second speaker for 2 minutes. Thank you.
Thank you, Mr. Jones. I'm Frank Mecca, the Executive Director of the County Welfare Directors Association, and our members are opposed to the bill. We're certainly very concerned about the impacts on children. Not to repeat the testimony that you've heard already, I just wanted to address the statistics about participation that the author has cited that give rise to the bill. California has joined the rest of the states under the Schwarzenegger administration and the prior administration in arguing against the really unfair federal participation definition. The 25% number is 25% of people that are meeting an arbitrary federal standard that we have all universally opposed as unfair. Let me give you an example. It gives people no credit for partial participation. So if you're working for an employer and they happen to cut your hours in 1 week of the month, you don't count at all. We have activities that people participate in that the federal government doesn't acknowledge. It's a point-in-time measure. It doesn't look over time. And so I think if you look just at the federal measure, it really gives a distorted picture of the extent to which low-income people are actually working to move from welfare to work. Our members are very concerned that this would actually not help people move from welfare to work, but could be counterproductive, and for those reasons we're opposed.
Thank you. Other speakers in opposition, just name and affiliation, please.
Dee Hamby, California National Organization for Women, and we strongly oppose this bill.
Thank you.
Western Center on Law and Poverty, and strong support, or opposition.
I was going to bring you back up for another 2 minutes. If
Kelly Brooks on behalf of the California State Association of Counties in opposition.
Alberto Gonzalez with the California Immigrant Policy Center in opposition.
Julian DeVos with the Urban Counties Caucus, also opposed to the bill.
Karen Shane, Legal Services for Prisoners with Children, in opposition.
Tia Orr on behalf of the Service Employees International Union, we're in opposition as well.
Libby Sanchez, Laborers Local 777 and 792, also in opposition.
Kevin Esner and Coalition California Welfare Rights Organization, strong opposition.
Jasmine Frazier, I'm a single mom and I oppose the bill. My name is Kelly McAdoo. I'm a CalWorks recipient as well as a single mother with 2 children, and I oppose this bill.
Thank you. Other speakers in opposition? Comments from the committee?
Thank you, Mr. Vice Chair. Yeah, I think some of the discussion has highlighted, I think, the snapshot in time issue. You know, I don't think that statistic of participation really tells the whole story, because if you're working, if you're trying, if you 1 week or 1 month fall short, you get lost in the statistic. I do appreciate the author's belief in having accountability and having, make sure that people are actually doing what they're supposed to be doing under the federal regulations, but I also see Mr. Mecca's point that the way that one-size-fits-all federal definition doesn't necessarily do the program justice. I'm also concerned in that some of the reforms have led to some cost savings. The analysis talks about, reducing costs by $500 million, and then sort of the impact on the health system, and in particular calls out the potential increase in infant mortality and the use of other medical services. So, I can appreciate the author's idea to try to save money, but I think this in reality will end up costing the state more money, and I don't think helps folks get back into the workforce. So for that, I'm not going to be supporting this bill.
Mr. Garrick, I've got a couple of questions, but did you want to reply to any of the testimony in opposition? Or
at the end, I'm closing if you don't mind, Mr. Chairman.
Just a couple quick questions. It's kind of my suspicion that California's generous welfare programs are a magnet to draw people into California from other states and other countries. Would you agree with that? And if so, would this bill go to reduce that
would
magnet?
Be the intent of myself being the author, to try and reduce the incentive, since we are amongst the most generous in terms of multitudes of benefits, not just the cash benefits that I did mention, but I did identify others. And for the hard statistics, with the state of California having 37.5 million people, that's 12% of the national population, but we have 32% of the United States welfare population.
Wow.
That's a frightening figure for this state to be carrying that many. and the cost with already the highest tax burden in terms of sales tax in the entire United States, the second highest income tax burden on the citizens, and the highest gasoline tax per gallon. So with 32% of the entire nation's welfare population in the state of California, which only has 12% of the nation's population, that's a close to a 3-to-1 ratio. And again, speaking to the specific bill, reducing it from presently 60 months to 24 months. That's 24 months that you can be out of work receiving these benefits, and that can go on during your lifetime at any time. If you were to acquire a job after 6 months, you still have 18 months remaining that you can work on that job. Say it went away after 2, 3, 4 years, you can go back onto the program. There are 24 individual months that you could access this program.
Great. Then, one last question. In your cost savings, you quoted cash savings and services savings. Did you happen to quantify the savings that the department itself would have in streamlining of services and in reduction of services, just being able to make the department smaller?
By shrinking the size of government, there would undoubtedly be savings. I did not take the time at this point to quantify.
So you could certainly add that to the cost savings.
Add that to the cost, which would bring easily over $500 million or $500 million.
Great.
In savings for our state.
With that, I'll allow, if you have a closing statement. That
I thank you again for the opportunity to present this bill. It addresses what is a disproportionate number of individuals that are on the welfare or the CalWORKS program as it relates to the federal statistics. Again, I can only repeat the numbers that have been shared by myself throughout this presentation, that when we have 37 million people, 12% of the nation's population, yet 32% of all of the welfare cases in the nation are in our state of California. It's far too generous a program, and it's time to reduce the generosity. We can't afford it anymore.
Thank you. We have a motion and a second. Please call the roll.
Bell? Jones?
Aye.
Jones, aye. Amiano? Grove? Aye. Grove, aye. Hall? Portantino? No. Portantino, no. Bill's on call 2-1.
You have 2 aye votes. You need 2 more. Your bill's on call.
Thank you, Mr. Chairman.
Next up is file item number 15, Mr. Lara, AB 1110. Whenever you're ready, sir.
Thank you. Mr. Chairman, Mr. Chair and members, AB 1110 will ensure that disabled foster youth get important information regarding their Supplemental Security Income application known as SSI. Children in foster care who suffer from serious mental and physical disabilities are among California's most vulnerable citizens. They often qualify for financial health care assistance from the SSI program. Youth who qualify for SSI may receive benefits while in foster care and can continue to receive assistance from SSI after they're emancipated from care. Current law requires county child welfare workers to screen youth for SSI eligibility and apply on their behalf when eligible. However, the law does not require reports to be made to the court to ensure SSI screenings have occurred and to be able to track the students of the application. These usual impacts this usually impacts the decisions regarding planning for youth to transition out of foster care. AB 1110 will do 2 things: ensure that disabled foster youth who qualify for SSI are informed about their status of their SSI application and are notified when the county has requested to be the representative payee. With me to testify in support of AB 1110 are Angie Schwartz from the Alliance of Children's Rights and Ed Howard from the Children's Advocacy Institute, both in support of the bill.
Thank you. Speakers in support.
Good afternoon. Angie Schwartz with the Alliance for Children's Rights, a co-sponsor of AB 1110. California has been at the forefront of legislative reforms to ensure that foster youth with serious disabilities gain access to SSI benefits prior to their emancipation out of foster care by requiring counties to screen youth for potential eligibility and to make applications on behalf of youth who are likely eligible, and by further requiring that for those youth who receive SSI while they're in foster care that those benefits are managed in their best interest. These prior legislative reforms have helped thousands of California's youth receive this critical safety net prior to emancipation from foster care. But it does not require, current law does not require that the minor's attorney, the court, or even the youth receive notice about the status of these SSI applications, which can lead to adverse and unintended consequences. Just this week, I had an attorney call me to tell me about a client of his who had had an SSI application made on her behalf while she was in foster care, just as California law requires. She had been repeatedly assured by her caseworker that hers was a slam dunk case, and so they closed her foster care case while her application was still pending and moved her into disability-based subsidized housing, telling her not to worry that as soon as the SSI was approved, she would have the funding to begin paying for her rent. After a few months, she started contacting people trying to figure out what the status of her SSI application was, but to no avail, and she lost her subsidized housing, which requires that the SSI be in place in order to stay. She finally learned that her SSI case had been denied at the first stage and that the county had not sought an appeal, which is often required with the Social Security process in order to get benefits approved. She never received notice of the denial. She never received any information about how to pursue her SSI application herself. AB 1110 will ensure that this doesn't happen to other youth by making sure that the youth, the court, and the minor's attorney are all informed about the status of the SSI application, what the decision is on the SSI application, and how to access benefits once the youth emancipates. This will ensure that appeals are pursued, that a youth's case is not closed while their SSI applications are still pending, and will greatly assist in the transition planning for these very vulnerable youth. I'm happy to answer any questions and respectfully request your aye vote.
Thank you. Second speaker.
Good afternoon, Mr. Chairman and members. Ed Howard with the Children's Advocacy Institute. I just want to quickly highlight one of the things mentioned by my colleague. The bill also ensures that foster youth and counsel for foster youth get notice when the county seeks to become a representative payee. What that will do is simply this. It will ensure that foster children, through their attorneys, will be allowed to participate in a meaningful discussion about what happens to what is, after all, their own money. This is important not just as a principle, but as a practical matter. American parents give a median of almost $50,000 in assistance to each of their own children after 18 to help them achieve self-sufficiency. This bill, both prongs of it, would be a very modest step toward making sure that we start treating foster children with the same degree of care that we treat children who remain in the home. And I also respectfully ask your aye vote.
Thank you. Move the bill. Thank you. Do we have any other speakers in support?
Leslie Heimaw from Children's Law Center. Just want to add our support for this important bill. Thank you.
Okay. Any other speakers in support? Any speakers in opposition? Mr. Lara, staff is asking me about some amendments. Have you been?
Yeah, I'll be happy to take the staff amendments.
Let me take the speaker real quick and then, okay.
Hi. My name is Kevin West, former foster youth. I just want to say I'm in support of this bill.
Oh, thank you. I did ask for speakers in opposition, right? Okay, just want to make sure I didn't skip a step. Okay, we're good on the the amendments. I will provide the second for the bill. Are there any other comments from committee?
Thank you, Mr. Chair. I just have a couple of questions. So if you know, when they notify, the courts notify, or the system, the county notifies the courts or the judge or whoever that they're eligible for SSI benefits or they've been through the pre-screening, is the payee always the county, or can the payee be the foster youth themselves? I'm just curious.
Do you want me to answer? Sure. The payee is not always the county. The representative payee for youth that are under 18, it's presumed that they need a representative payee, so because they're children, and so it's presumed that they need someone to be accepting the money and spending it in a manner that meets their best interest. But it doesn't have to be the county, and in fact both federal and state law have a priority, and county agencies and federal agencies are the last among those to be chosen as representative payees, because obviously it's preferred that it be a parent or a relative or a guardian or a close friend or someone else. So there's actually a list of people who could serve as the payee before the county would serve as the payee. So again, as Ed Howard noted, this would just make sure that in that assessment of whether or not there's someone available to serve as the youth payee, because some youth in foster care are not going to have anyone who is really able to serve in that capacity, and then the county would be stepping in that capacity so that they can get the money and that it's managed in their best interest. But before that decision's made, we just want to make sure that they've had a full assessment and that the Minors Council is part of the decision and the court's part of the decision of assessing whether or not there's someone else more appropriate to serve in that capacity.
Thank you. Thank you.
And I just want to clarify, Mr. Prey, I'm sorry, Mr. Lara. Mr. Prey is next, and I'm already...
The other Mexican.
I'm glad the chair is back, because I can hand this back over.
I don't know.
I also sit on the Judiciary Committee, and I haven't had an opportunity to speak to the Judiciary staff about this bill yet, but I will support it today, and then anticipate, hopefully we won't have any challenges in Judiciary when it comes to Judiciary. So thank you very much.
Thank you, Mr. Jones.
Any other comments from the committee? All right, we have a motion and a second, and the chair is back, thankfully, so we'll go ahead and call the roll.
What's the motion?
The motion is to do pass.
As amended.
As amended. Thank you.
Bell?
Aye.
Bell, aye. Jones?
Aye.
Jones, aye. Amiano? Grove? Aye. Grove, aye. Hall? Aye. Hall, aye. Portantino? Aye. Portantino, aye. The bill is out.
Thank you.
Thank you.
Thank you. We'll go item 5, I guess, is next on the list. Harry Pereira. Harry? So you have the floor.
Thank you. Mr. Chair, members of the committee, I will do my best to be brief. First off, good afternoon. CalWorks provides assistance to employment services to eligible families and children who need temporary financial assistance. CalWorks money is used to provide basic needs for under-resourced families that are in the greatest need of food and shelter. AB 493 would require the Department of Social Services to take all necessary steps to ensure CalWorks recipients may not access the taxpayer state-provided cash benefits from ATMs in gambling and adult entertainment establishments. It would also prohibit electronic benefit cards, also known as EBT cards, from purchasing alcohol and tobacco products with any CalWorks money. In an 8-month period from November of 2009 to May of 10, there was an average of over $227,000 a month of EBT cash ATM withdrawals at California casinos and card poker rooms. 227,000. Roughly 76% of all CalWorks recipients are children. CalWorks is here to help make sure children are provided with the basic needs, not for adults to purchase alcohol or to gamble at casinos. CalWorks is the state's largest aid program for needy families, and according to Governor Brown's budget proposal, it is expected to serve 580,000 families each month in the next fiscal year. I'd like to end there.
There's a motion and seconds for the bill.
And just respectfully ask for your aye vote, and we do have Guy Christian from the California Fraud Investigators Association, and I believe Christy Boma was here from the California Professional Firefighters in Support. So,
yes, I'd like to address the committee. I have a unique position in that I'm a welfare fraud investigator. Unique in that I not only get to see one side of the program, but I get to see the other side of the program. Prior to this job, if you would have asked me what we do and how do you eliminate fraud in welfare, I would have simply said it's real easy, just eliminate welfare. That solves it. After about a year, I found out what I didn't know. And I found out that the program helps more people than any of you realize. While you sit in Sacramento, myself and my investigators are in the field every day and we work. And we find people who are doing the very best they can do. whether it's a limit on them because of age, or it's a mental issue, or it's a physical disability, educational, whatever it is, they're doing the best they can do. This program helps them. Last year, we rolled along, and all of a sudden, here came the newspaper. And with that came those great articles about casinos, adult venues. We got an executive order. This bill changes that into a real law, makes it there, makes it solid. Our SNAP program, which is our nutritional program from the federal government, doesn't allow the purchase of alcohol and tobacco. Geez, a nutritional program that says we shouldn't use those things that have been proven to be bad for us. Yet California, on our cash side, doesn't put any prohibition on purchasing those products. Consequently, we see the state running our ads about how dangerous tobacco, how dangerous alcohol is for us, and then we allow people to use taxpayer funds to buy it. And most of these people are on Medi-Cal, and where are we going to be spending the money next? The bottom line is this: every time we read a newspaper that says something bad about the welfare system, we're not doing our job in program integrity. And that's what we need to be doing. This bill addresses one little piece of program integrity. One piece. Now, I know we have large budget issues and all this, but you know what? I keep hearing all the time, everybody in California's got to work together. One of the things that scares me most is this. Taxpayers right now are not ready to tolerate fraud and abuse. They want it stopped. If we can't show them that we recognize there are difficulties, cash aid is made to help people, not to buy those items they don't need for subsistence. That's what it's for. If we don't take those actions, sooner or later, someday, when taxpayers get a little bit madder than they are right now, they'll make demands on you to change more than they're demanding today. That will hurt the program.
I move the bill, Mr. Chair.
There's a motion and a second. Yeah.
Great.
Okay.
Thank you.
Other speakers in favor? Okay, speakers opposing.
Mr. Chair, Mike Carroll with the Western Center on Law and Poverty, and we are here in respectful opposition today. I was actually encouraged by the comments of the supporter of the bill. I do think it's time for us to recognize the significance and the fact that this program largely runs very, very well. The statistics that were cited in the newspaper reports and other places that came out last year, when you dug through all those details, what we really had was these funds being used in less than 0.5% of all the funds that go out from our CalWORKs program every year. So while on the surface, certainly none of us support using money to go to adult entertainment or to be gambling, but there also are very many benevolent responses and reasons why those might have been occurring. People actually work in casinos. In many rural areas of California, an Indian gambling casino, an Indian casino may be the only place where there is an EBT machine in the local area. So they may be simply withdrawing their cash there because it's convenient. And there's no indication at all that a single dollar of this was actually spent on gambling. So, but I want to just back up. I think the other issue that we must address here in front of this committee is how far we are willing to go to establish a state apparatus that will control the purchases of families on this program or any other public benefit program. We used to do things like this. In the old days, you had to go down every month and you had to demonstrate to the worker where you're spending your money. But you know what? We found out that was an extraordinarily inefficient program. It really didn't serve much of a purpose, and it costs a lot. And so now we have bills that we're seeing frequently come out to limit sugary drinks, bad food for you. I saw a bill this morning from another state that would require people who buy clothes who are on cash assistance would have to go to a thrift store. You know, we get into this sort of mission creep where we begin to start to think that we can dictate the choices of everything that families do, and that will somehow make them better. But really what we're doing in CalWORKs, as I think the supporter noted, is that we're helping families become self-sufficient. This is a program that helps people get their lives back together. But it's not just about getting a job and making money. It's also about having self-sufficiency to manage one's finances and make the right decisions. And when we begin to take these decisions away from families, we lose that learning experience. So, you know, for us, we have to really question, do we really want to build an infrastructure to control how people spend frankly, very small amounts of money, and after the last CalWORKs grant cuts, even smaller amounts of money? You know, when billions have been cut from the CalWORKs program, is this really going to be the best and highest use of the funds that we have remaining in the program? And then lastly, you know, we would strongly urge the committee.
If you can wrap.
I'm on my last paragraph, and I'm just about to finish. Thank you. Lastly, we urge the committee to carefully consider the potential stigma that are created by these kind of measures. Why do we only suggest that somehow CalWORKs recipients should be subjected to such limits on public benefits? We provide unemployment benefits, we provide Social Security, the feds do, we provide SSI, we provide general assistance, we provide all sorts of other programs, but for some reason, this population is being selected out in particular. We think that reinforces the negative stereotype that already exists around the population.
Thank you very much.
Thank you, sir. I'm sorry I went on.
Additional speaker in opposition.
Thank you, Mr. Chairman. Frank Mecca with the County Welfare Directors Association, and we too share sort of the spirit and the goal of the bill. We want CalWORKs money spent to further the well-being of children as well. Our concern with the bill is that we think the prohibitions would be of limited effectiveness, and we think we would have to spend quite a bit of funds and effort trying to set up an apparatus to control what is a relatively small purchase, at the same time that over the last 2 fiscal years, we've pulled about $1 billion out of the services that help people move from welfare to work. We've pulled huge amounts of money by slashing CalWORKs grants. What the county welfare directors and the state believe is that we need to focus on our resources on moving people to work and setting up an apparatus to chase relatively small amounts of money in response to what really is sensational sort of poor journalism rather than a real sort of public policy issue. It takes us in a direction that does not help us get people off this program and get into the workforce, and that's what we want to do. And for those reasons, we're opposed.
Thank you. Additional speakers in opposition. Name and affiliation, please.
Kelly Brooks with the California State Association of Counties, also in opposition.
Thank you.
Hi, my name is Princess. I'm in opposition.
Thank you.
Hi, Coalition California Welfare Rights Organizations, Kevin Adlingen. We also oppose this bill, and it should be noted that food stamps cannot be used to buy soap, deodorant, and other stuff. Thank you.
Thank you. Any comments from the committee?
Thank you, Mr. Vice Chair, and thank you, Mr. Perea, for entering into this discussion. I mean, earlier today in this very hearing, we saw an effort to try to cut CalWORKs benefits. And to me, if we don't support this bill, we give credibility and we give fodder to those folks who want to do that. You know, we should be embracing a very simple, sensible reform here for folks who want to fight to help people help themselves and help people get back into the workforce and help families. It's not about limiting a choice. It's about having the funds be used for the intended purpose. And the intended purpose of this fund, for this money, is not to buy alcohol, is not to buy cigarettes, is not to go to adult establishments, is not to go to casinos. This money is intended to help a family help themselves. And so it's not limiting the choices, it's being consistent with the purpose of the funding. And so to me, it just seems like this is the type of reform we should be embracing because it helps us make the system more efficient And the better we make the system, the better we make a credible case of why it's cost effective. It should be expended. And that's why we should make the expenditure. And that's why earlier when I opposed the bill to cut the program, it was because that cut would end up costing the state more money by driving more people to emergency rooms and increasing the infant mortality rate and not helping those families. So where we see a sensible reform, and I applaud you for bringing this, and I know it's controversial from our own people who we are normally on the same side with, and those are our friends. And I know it's a tough decision. So I'm going to support this today because it just makes the most sense to make the system work and have the state's money go for its intended purpose. So thank you for doing it.
Thank you.
Mrs. Grove.
Thank you, Mr. Chair. Mr. Perea, thank you for bringing this bill forward. And I would have said exactly what Mr. Portantino said had Mr. Jones called on me first. I applaud you for doing this and bringing, and for people who come up and testify against not having this, and it's for the families and it's for the children. It is not for the intent of purposes to buy alcohol and the other examples that were used in this legislation. So I appreciate that, and I am honored to support your bill.
Thank you.
Any additional comments from committee? We have a motion and a second. Please call the roll.
Bell? Jones?
Aye.
Jones, aye. Amiano? Grove? Grove, aye. Hall? Hall, aye. Portantino? Portantino, aye. Bill is out.
Great.
I think
Thank
you have
very
4
much.
votes. You're out.
Thank you.
Congratulations.
Thank you for doing my close.
All right, I see Ms. Bonilla is here, so we'll take up item number 11, AB 846. We've been looking for you.
Thank you. It's been a busy day. Been over in the Health Committee. Thank you very much, Vice Chair, members. AB 846 makes technical changes to existing law to further protect foster youth from the effects of identity theft. As you probably realize, foster youth are particularly vulnerable to identity theft because their personal information often changes hands as they move from placement to placement during their childhood. And identity theft, as you realize, can ruin the ability of foster youth to successfully transition into adulthood. This bill seeks to better direct and correct cases of identity theft for foster youth prior to their emancipation from the foster care system. AB 846 clarifies the way county welfare departments would request consumer credit disclosures for foster youth, as well as the procedures for handling identity theft if it is discovered. Specifically, this bill allows